Cancer seems to be very prevalent, especially here on Long Island. When you think about cancer, there's one that pops into your head right away. That's breast cancer. We hear and see this everywhere, from walks to runs to countertop cans in businesses soliciting donations. It's great to have such awareness. However, did you know the 5-year survival rate of a person diagnosed with breast cancer is almost 90%? That means that 90 out of 100 people diagnosed will survive. I'd like to talk about a cancer that seldom people think of or even know about. Its 5-year survival rate is only 4%, which means only 4 people out of 100 diagnosed will survive. This killer is stomach and esophageal cancer. I know about this only because my father was diagnosed with this in August of 2013. What I noticed when doing research on this is there's not a lot of time or effort being put into finding possible cures or treatment to extend the lifespan. As I stated before, many people only know about breast cancer. To illustrate this, I've conducted some interviews.
Breast cancer is the most known cancer, in my opinion.
Breast cancer because it's everywhere, and even do like breast cancer awareness games.
Breast cancer.
Definitely breast cancer.
Honestly, I'd say breast cancer. I think breast cancer has the most awareness.
Probably breast cancer.
I think that breast cancer seems to be the most, has the most awareness because it's everywhere you go in media and magazines and on radio. That's all you usually do hear about breast cancer. You have the West Side Breast Cancer Coalition. They do a lot of stuff with dance. So yeah, I definitely think breast cancer is.
I guess definitely cancers like breast cancer, stuff that we have in Relay for Life for, and there's a whole month for it, so.
I think breast cancer.
Breast cancer.
Pink.
Pink.
Yeah, pink.
Pink.
Pink. Pink.
Pink.
Yeah, it's pink.
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 Yeah, of course, October.
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 Breast cancer awareness month is October. I believe November.
Pretty sure it's in October.
It's in October.
October, right?
October.
No.
No, I'm not sure.
No.
January, I think. I'm not sure.
No clue.
I have no idea.
No.
I have no idea.
Don't know.
No idea.
No.
No clue.
Periwinkle.
Blue?
I'm not sure.
I can't say. Not sure.
No.
No, I don't know.
I also have no idea.
I don't know.
No idea.
Yeah, you can't just focus on one cancer because other people have different illnesses that don't have any way to speak up about it and people aren't sure about them.
Yes, because then you have other cancers that don't get any attention, don't get any money, and then they have problems with raising money to like help it.
Yes.
Why?
Because we should know more about the other cancers, not just one.
Yeah, definitely. I think that a lot of people are affected by breast cancer, so that's why it's the most common. But I think that all cancers are just as bad as the other, so everyone needs to share the wealth of the attention that they get.
I don't know if it's a problem, but I feel like there's definitely a bias because breast cancer is definitely focused on more so than any other cancer that I know of. Yeah, I think they should all be recognized.
Yeah, I do.
Yeah, there is a problem. it seems how much you potentially give to one cancer, because it shouldn't be necessarily just one specific type of cancer, because cancer is cancer. It just affects a different part of you.
Yeah, it should be, if everybody's equally affected by all different types, the research and the involvement to try to find a cure should be the same throughout.
Yeah, because not one cancer is like more like severe than the other.
I don't think it's a problem. I think it's a little uneven, but I do think when we recognize breast cancer, it does bring some awareness to all other cancers.
Yeah, of course, you can't just focus on one group while the other people suffer and have no way to cure what they have, the illness that they have, and no way to speak up about it.
Well, because like you, for instance, you have stomach cancer, no one knows about it, no one's gonna raise money because no one knows, because no one thinks it's like bothers, like people get affected by it. But everyone hears about breast cancer, so then everyone raises money because everyone knows about it.
Yes, because we should show how we should support the other cancer, not just one cancer.
Yes, definitely. I think that everybody needs more awareness, and yeah, I'm not really sure. I just think definitely more awareness for each one.
Everyone feels like we need to be more aware of other types of cancer. I mean, I'm all for it. Personally, personally, my grandmother had melanoma, and my aunt had breast cancer, so I know those are like two pretty big things, but still melanoma isn't, like, that doesn't have big awareness. Breast cancer certainly does.
I think we should, because they're all going through the same thing. Just one cancer. Shouldn't be singled out.
Absolutely. I think that people are fighting for their lives no matter what cancer they have, and we should give equal awareness to everyone.
Yeah, I think you need to give attention to all different types of cancer, because this cancer is a very debilitating disease, and just focusing on one different specific type of cancer is it's not necessarily belittling other different types of cancer, but they just deserve the same amount of attention.
Yeah, I think we should. I think more awareness for any type of disease or cancer or whatever, more awareness is going to help people get better faster. So.
Yeah, because not one life matters more than the other one.
I do think we need more awareness to help support people who are suffering from different cancers and not just breast cancer, to help raise money to fight all types of cancers, because it's a horrible disease, and people need support for whatever troubles they're going through.
As you can see, many people are affected by the deadly disease we call cancer. The statistics show there are more people diagnosed with breast cancer, but with a 90% survival rate, more are saved. Stomach cancer, on the other hand, is actually the 4th most common cancer worldwide, and because it is caught at its latest and most progressed stages, due to lack of early detection, it is the second leading cause of cancer deaths worldwide. This makes it just as important as breast cancer, and any cancer for that matter. All cancers affect the patient and their families, and every single one deserves the same amount of attention and research to finally put an end to this devastating disease.
The gastrointestinal, or GI tract, includes the mouth, esophagus, stomach, small intestine, and large intestine. It is here in the GI tract where digestion of food takes place. The stomach collects food and uses enzymes to break down partially digested food into usable nutrients. The stomach has 3 layers of tissue: the innermost, mucosal layer; middle, the muscularis layer; and the outermost, serosal layer. Sometimes the cells of the inner layer begin to grow rapidly and without order. When this occurs, cancer can develop. Cancer of the stomach is called gastric cancer. Gastric cancers can spread to the other layers of the stomach and to nearby lymph nodes. In the early stages of gastric cancer, symptoms can include indigestion, stomach pain, heartburn, and loss of appetite. As the cancer progresses, symptoms progress to blood in the stool, vomiting, weight loss, and the collection of fluid in the abdomen, called ascites. Treatment and prognosis of gastric cancer depends on the stage at which the cancer is diagnosed. Stages of gastric cancer refer to the number of stomach layers affected by the cancer and the number of nearby lymph nodes where cancer cells are also present. Stage 0, cancer is just beginning to affect the innermost mucosal lining of the stomach. Stage 1, cancer has begun to penetrate toward outer layers of the stomach or may have spread to nearby lymph nodes. Stage 2, cancer has spread further through layers of the stomach. More distant lymph nodes may be involved. Stage 3, cancer has spread through all layers of the stomach or is affecting more distant lymph nodes. Stage 4, cancer has spread to nearby tissues and organs, or is spread to more distant areas of the body through the lymphatic system. Treatment options include gastrectomy, the surgical removal of part or all of the stomach. Other options may include chemotherapy, radiation, or any combination of these 3 therapies. Your doctor is the best source of information regarding treatment for your condition. It is important to discuss with your doctor which therapy, if any, is most appropriate for you.